And it is 5 after 1. We're attempting to get started on time. First, we'll have Shelley to call the... no, first is the invocation by Councilor Frankie Hard.
Stand. Heavenly Father, we thank you for this day, and we thank you for bringing us together. And we just ask you, Lord, to give us guidance and wisdom as we deal with the business of the people. In Jesus' name we pray. Amen.
Amen. Thank you. Roll call, please.
Yes, ma'am. Janelle Fulbright.
Present.
Dick Lang. Jack Baker.
Here.
Harley Bezer.
Here.
Joe Bird.
Honey.
Juliet Coates. Here. Jody Fishing Hawk. Here. John Garvin. China Glory Jordan. Frankie Hargis.
Present.
Curtis Snell. Lee Keener. Denise Taylor. Here. David Thornton.
Present.
Victoria Vesquez.
Ani.
David Walkingstick.
Honey.
Eric Allen Watts. We do have a quorum.
Thank you. Now the chair will entertain a motion for approval of the minutes.
Make a motion to be approved.
Second.
All in favor of approval, let it be known by saying aye.
Aye.
Any opposed? The minutes are approved. Next, we'll go right into reports. And first, we'll have Mr. Valuers from the Claremore. Welcome. We're glad you're back.
Well, good afternoon. It's good to be back. The first item would be our MRI. I was told this morning should be back up taking patients the first of next week. It's been down for 6 weeks. We had the repairman from the company said that he'd never seen that before, but it had self-quenched. I think Kelly had mentioned that last month, and it had. We were using it for a couple weeks, and it went down. And so we're back up. We should be back up next week again. Staffing, we just started a locums, a temporary OB doc this morning. That gives us 4 in the OB women's clinic. We're working on doing a direct transfer on a Dr. Lopez from Pawnee. He's working at Pawnee now. He's in internal medicine. If we can get him over, that'll give us 6. We'll be back up to 6 physicians in the family adult medicine clinic. We're working on, we have 2 surgeons, staff surgeons, who are leaving. One is transferring to Alaska for a payback, and the other one is leaving and going to the Bureau of Prisons. Those were both kind of unexpected, and I'm working on a contract with the Oklahoma State University Medical Center to get a couple of full-time staff surgeons over at the hospital. The last thing that I'd like to point out is that in the federal side, we have a goal of 3% increases every year on our collections. And as of last Wednesday, we met our 3% for our collections for the year. So any questions?
You have 2 staff surgeons that are leaving.
Yes, sir.
So what do you have in plan for replacement?
We are in negotiations with the OSU Medical Center we're going to contract with them, and they will send over 2 staff surgeons.
Okay, this will be done immediately?
Well, they are actually, one is already credentialed and the backgrounds are done. We'll have the 2 there through the end of October. So my goal is to have those 2 from OSU in by the 1st of November when the other 2 leave.
Okay.
Yes, sir.
Okay, thank you, Madam Chair.
Councilor Buzzer?
Yes, I have a couple of questions. And I guess I didn't remember, maybe I didn't remember last meeting when the other fellow was sitting in for you about the MRI. I didn't know it was down for 6 weeks. Well, that's been 4 weeks ago, come from bed.
Yes.
I'm a little, it really aggravates me when we're down 6 weeks. It's just like And you're not the only one. We got an air conditioner unit down in one of our clinic, and it was down in July, and it was almost 2 months to get back to spare. People were working in there in 70 and 80 degree temperatures trying to do patients, and it's really concerning me when we can't get people to do what they're supposed to do. Especially with the new MRI machine, that is really disheartening to be down for 6 weeks. Well, it's not your fault, but fault of the company, and I hope somebody writes a letter to that company to let them know we're not happy with their services.
Well, we were lucky, it is under warranty,
Yeah.
everything was covered, so they stepped back in right away and got started on it. Yes, sir.
I don't know, I guess it's just aggravating to deal with companies and they put you off for 6 to 7 weeks, but we're talking about medical stuff for people.
Yes, sir.
And that's really important to me, to take care of the people. I got a couple more questions.
Okay.
And you probably have told us before, how many beds do we have in the hospital?
38.
38. And another thing that's, well, I'm going to ask you this question. You used to report on Cherokees that were denied services to contract health.
Yes.
And you stopped doing this for the second and third month. Why did you stop doing that?
Because most of those go, we have a Cherokee Nation contract health worker in our office, so anybody that comes through is just handed directly to her and taken care of directly by the tribe.
Okay, but we still don't know how many are denied then.
They don't go through our system.
Okay. Connie, can we get that from you on your? Oh, it is in your report. Okay, I must have missed that. Okay. The other thing that concerns me, George, at the criminal hospital is, I was looking at the report, and it says admissions were 59 for the month. Now, why are we only, I guess we don't have any sick people? Is that the reason we only admit 59? Or are there other reasons that we don't have doctors there that people trust? Or why do you like that?
No, sir, that's another thing I'm trying to address. We tend to transfer a lot of people out of the emergency room straight to Tulsa. One of the perfect example is if a patient shows up and they say they have chest pain, our docs have been in the habit of immediately just transferring. Well, we have a cardiologist that comes in once a month from OSU, and he has written a protocol for them that if they'll take an EKG and do some blood work, they can rule out and be able to make a definitive decision right then whether it's a cardiac event or whether it's a non-cardiac event. Well, if they go through that protocol and it's a cardiac event, those people need to be shipped. If it's a non-cardiac event, say it's a GI or a gallbladder or something like that, we should keep those in-house. So we're trying to get them educated and all on board doing the same thing.
Okay, and I didn't see your, how many beds were filled for last month in the hospital? I don't see that. On a percentage-wise, what is it usually?
We were 15% for admissions.
Admissions?
Yes, sir. We were down 15%. We were at 15% for the whole month.
Okay,
That's not very-
okay, I see what you're saying.
That's not very good.
Well, that concerns me, because I know we have a lot of Navy people that use the Criminal Hospital. Yeah, that's not very good, so I'm concerned about health. I would like to see those numbers raised, and I know you're probably doing
Oh, I would too.
what you can do. Anyway, just, George, keep on it, and keep reporting these facts, and hopefully we get to see more people, and maybe not go to Tulsa. I think what you're talking about,
Oh, absolutely.
the person's coming in and do some protocols, it should help. So,
Yes.
appreciate it.
Thank you.
Thank you, Madam Chairman.
Counselor Taylor, you're next.
You mentioned that you had mentioned 3% increase. When does your fiscal year actually end?
September, the end of September.
Okay, so you just right on that. Okay, and then I did notice from your report that your revenues are up over the same period last time, even though a lot of the other things are down.
Yes.
So you've gotten it across to your staff. We need to get those collections in, so
Yes.
good job.
Thank you. Thank you.
That's all.
Speaker Jordan?
Yes. George, next month, would you break down on a daily basis how many people you have as patients in your hospital?
In the hospital?
Yeah, like you had 59 admitted. Can you break down how many were in there on a daily basis, starting from the 1st through the 30th of September?
Yes, ma'am.
Yeah, I guess is that called a census count?
Yes.
I just like to see it on a daily basis.
Sure.
And if you would, I noticed you had 29 newborns, so I guess that means 29 mothers were also in the
Yes.
hospital at the same time. If you could break down what was for to have a baby and what was to sleep study, break it down whether it was a sleep study, having a baby, or surgeries, or just give us kind of a breakdown of why they're in the hospital. Okay? Appreciate it. Thank you.
You're welcome.
Councilor Watts?
Thank you, Madam Chair. Hi, George. How's it working with the Marshal Service? They said they'd increase the drive-bys, or?
We have no problems with the Marshal Service. Marshal Service is doing a great job.
Very good, thank you. And then on your CH numbers in the report, that is only those CHS folks that have nothing to do with the Cherokee Nation, or does that also include Cherokee? Okay.
No.
And were we able to work through some of those process issues that I've raised with contract health service, different individual cases?
Yes.
Okay.
Absolutely.
Thank you. Thanks.
You're welcome.
Any other questions or comments? Thank you, Mr. Valuers, for that good report. We appreciate it very much. Next will be our Health Director, Connie Davis. And counselors, I ask that you hold all your questions till she finishes her report. And then just jot down what you want to ask her and let her completely finish, and then we'll take questions. Please.
Thank you. If you don't mind, I got permission from Ms. Fulbright before this. I've asked Dr. Mira, our infectious disease specialist, to come in and speak about this enterovirus 68 that you hear going across the nation. I know you probably have lots of questions and will be fielding that. So he's going to give us a less than 3-minute presentation and discussion on that. Dr. Mira, thank you for coming.
Thank you for inviting me. As you all heard in the news, there's been some concern about this. It's not a new virus, but it has been a virus that's been kind of quiet for the last 30 years. So this is an enterovirus that's causing respiratory illness, and that has caused many children to be admitted in critical care hospitals throughout several states. This virus was isolated in 1962 in California. It didn't cause much turmoil until recently. First reports were from Kansas City, Missouri, and from Chicago, Illinois, and now we have reports from Colorado, Kentucky, official reports, and from the news this morning in New York also. What this virus causes is severe respiratory disease, mainly in children. Ranges are from 6 weeks to 16 years old, usually in children who have a history of asthma, but not all of them have a history of asthma, 75% do. And the most important clinical characteristic is that it doesn't come accompanied by fever, which is a common symptom in most of the infections that we see. There's no vaccine, there's no specific treatment except for supportive treatment, and there are ways to diagnose it, and we're working on that. As of the information for Oklahoma, there's no official cases reported yet. I wouldn't be surprised if we haven't because of the vicinity of the states which have reported this virus. What we have done so far in our hospital, Hastings Hospital, to address the problem is, first, we adopted CDC recommendations of any patient who's admitted to the hospital with a respiratory illness that we don't know what the cause is, to put them in contact and drop their isolation. We have a meeting this coming Thursday with the head of departments to design a contingency plan in case we have a big problem with this virus, and we're working with administration for a diagnostic test to be implemented as soon as we can. And that's kind of in a summary.
Thank you very much.
Any questions for him? Thank you, Doctor. Okay, go ahead.
Madam Chair. Will we be working, I don't know if George has the same resources at Claremore Indian Hospital, but is there a similar response with Claremore Indian Hospital that we haven't seen any cases and that people will be isolated, or there's special meetings and training going on? Is that something we can offer and assist him with, if that's?
Absolutely. I can speak to that later in my report as a matter
Okay,
of fact.
thank you.
Thank you, Dr. Mayer.
Thank you.
All right, a few highlights from the report this month. The volumes are on the front page there. Wilma P. Mankiller saw 9,940 patients. Redbird Smith, 10,253. Salina, 8,341. J, 6,996. Nowata, 4,454. Three Rivers, 14,729. Bartlesville, 2,017. Bonita, 6,693. Gaudougie Clinic, 423. And Hastings, 30,901. And you can just see every month the volume's going up in all the respective clinics. The other things I'd like to highlight were in July, there was the Oklahoma City Area Director Awards, and several of our staff were recognized for their years of service and merit. But a particular note, I'd like to recognize Dr. James Stallcup. He received a Superior Management Award, and Dr. Henry Smith from the J Clinic received an Exceptional Service Award.
Are they here?
Excuse me?
Are they here?
They are not here.
It's on.
We've had two docs hired on at the Bonita Clinic, Dr. Cameron Rumsey and Dr. Diane Hardy. That's good news for that clinic. Also, highlights from Hastings, the ER and urgent care treated 5,947 patients and experienced left without being seen of 4.8% in the emergency room and 4.8% in the urgent care. And last month, Speaker Jordan had asked that we track the times from arrival to discharge, and those are included in the report for your consideration, and I know Mr. Hill plans to continue to report that for you as well. The dental department continues to see huge volumes of patients, 1,353 new patients in the month of July. I'm happy to report that our behavioral health department has resolved the wait list. As you'll recall, in July, it was well over 500, and there are no longer any patients on that wait list. So Joni Duffield in particular, and that entire staff deserve recognition for a job well done.
Yes.
And in Claremore, there are 4 patients on the wait list, and they need prescription meds. So they've been impaneled back to, or referred back to their primary care. But the good news is we have a letter of intent for a nurse practitioner to start in October, so they won't encounter that delay any longer. The PACE program has 126 patients. An update to our VA agreement. I got a note late last week that we have collected $39,700 from our VA payments, so that's going well. We're getting compensated for our vets. Another item to highlight is our joint venture application for the hospital has been sent in. The first big hurdle is October 10th. We'll be notified if we've made it to the next area for consideration. So by that time, we'll have October's health committee, and I'll be able to hopefully give you more good news that we're progressing in that approval process. As a follow-up to several requests over the past year or so, a staffing plan for the expansions, and I want to show these PowerPoint. Just approved the FY15 budget, and so I'll just note, it's so detailed. I know it'd probably be difficult to tell what positions may be new or associated with the expansion, and to highlight that, Sam Hyder, there was a physical therapist for that new expansion. Wilma P. Mankiller, there was a nurse practitioner, and we've actually already hired that nurse practitioner. And Cooey Scooey, there's a budget for a new doc and a new nurse in the clinic. And then for FY16, of course, pending funding, we plan to add the physical therapist to Redbird Smith, the other doctor and nurse to Sam Hyder, another doctor and nurse to Wilma P., and then the associated supportive staff for the rest of the clinics. Of course, this all depends on patient volume, growth, and the ability financially to support those things. You know, our thoughts are the expansion in space are what we really need in those areas, and so we'll keep a close watch on that, and as our docs reach a full panel and are able to process those patients effectively and efficiently, we'll add staff as needed. We did have a conference call with Oklahoma City Area Office and George Valier and Kelly Batiste concerning some emails that we had received and some complaints. They are down to one OB, I guess two now, two OB providers. And our understanding from that visit last week that the chief asked us to do is that they do have mid-levels to do deliveries there, but it's OB/GYN surgeries that they won't be able to do for a while, and then one surgeon. And they also, in June, have stopped doing pain management, which has created a little bit of an influx, or quite a bit of an influx on our clinics. So the chief has asked us to begin meeting routinely with the staff at Claremore Hospital and helping resolve them and work closer with them to help support the patients in that area. And so I'll give you a report on those meetings and how they go every month as we progress. And the final thing I thought I would mention is that, and some received an email, but the flu vaccines are not going to be delivered to us until October, so some of our clinics or community meetings that we've scheduled to do vaccines, if they're before October, we won't have those vaccines available.
We will not.
Not before October. And Jeff, unless you have something?
Some of the vaccines for flu will not be available. I think we'll
Wait, counselors, hold your questions till 3 questions till everybody has a turn to speak. And since I'm the chair, I'm going to speak first to get my question in. I don't want to be last. I'm always last. Okay, my question is this. At the Redbird Smith, we're wonderful with the new physical fitness area for the employees down there. But someone, now I'm not going to say who told me this, but someone gave me the impression. They said, it's for the employees only right now. It's a fabulous outfit down there for them. But next year, we're going to put in our budget to hire a couple of people to direct it, and we're going to let our patients use this facility. And I don't see where that's materializing anywhere, so I know I didn't dream that up. So can you kind of look into that? Because it is really a nice fitness center, and a lot of the employees are utilizing it, but it's plenty big enough that if we had someone in there to be in charge, I know you can't just open it up to the public. All those machines are complicated. It wouldn't do for anybody like me, but we've got to have somebody show them how to do it and everything. So I'd like to see it utilized for the people that want to use it. That's my comment and question and directive. Now we'll take questions. Councilor Thornton, I saw you first.
Thank you very much.
And anybody else that wants to speak, I'll put your name down.
Okay, we're talking about Redbird Clinic. The physicians or the doctors that we lost down there, the 3, have you did anything, or do you have anything going to replace those?
Can't say that I personally have, but Dr. Montgomery has been very busy, and if you don't mind, I'll defer that question to him.
Okay.
We have recently had a new doctor come on board, Dr. O'Neill, who's been there a couple of months. Dr. Duke will be leaving in October. We've signed a new advanced practice nurse to come in, to be starting in October.
A new what?
APRN, or advanced practice nurse. It will be coming in October, and we're hopeful, I don't think I'm speaking out of place, that her spouse, who's a physician, may also join us. And we're going to come out back even with those that have left with new hires.
How we doing on males and females for those three?
That we're not doing so well. I have no control over that.
Okay,
But we do have a predominance of female providers there.
okay.
We're going to, again, just can't control who knocks on the door.
Well, Dr. Montgomery, I was under the impression we had 2 advanced level people leaving, and you're telling me you're replacing one? So we still...
Range left, they're there for quite some time. And Aaliyah Walker is leaving.
So you found one replacement, you still need another? Okay. Well, the reason we're getting a lot of calls about people, angry and mad and say, I had an appointment with Dr. So-and-so, one of the physicians, and I waited for an hour and a half, and they kept saying, she's in an important meeting, and this lady said, I have a JOB, called a job, and I have to be teaching at Warner or herever, I can't sit here any longer, I'm leaving. They said, oh, well, she would see you. And they said, I can't wait any longer. People don't like to wait an hour and a half when they have an appointment, and if there's a shortage down there, it just makes it worse. And the other night, I introduced our director of our clinic down there, Jerry Kaufman, at our house when we had our 50th anniversary. And I said, he's the director of the Redbird Smith Clinic, and if you have any complaints, please call him. Don't call me. So, we get more than our share, of people. My point is, please try to fill these as quickly as you can.
Working very hard on it.
Okay. Thank you. Next is...
My turn?
Go ahead and finish yourself.
Well, thank you.
It's payback time when you wouldn't let me talk at your party.
Well, you didn't vote for me about a certain deal. You remember that? Okay.
Moving right along.
Okay, let's get this over with.
Thank you.
Send these personalities going over here. As far as dentist, I see you put a Mr. Hubler to work part-time over there at Redbird.
Yeah, he's going to be working 2 days a week for us.
Okay, do you have anyone else? How many dentists do you have on there?
3.
How many seats you have?
12.
Okay. So are you going to work it with 3, or are you going to put him more over?
No, it's fully staffed to be 3 dentists and 2 hygienists.
Okay, but are the 3 dentists full-time, part-time?
Dr. Huffler's coming on full-time. He's transitioning out of a private practice, so he's going to start off 2 days a week for a few months, and then increase to 3, and then increase to 4 days a week.
Okay, that's Parley, right?
Yes.
Okay, who's the other one?
Dr. Drew Lard and Dr. Sweeney.
Who?
Drew Lard and Sweeney.
Queen?
Sweeney. Dr. Sweeney is your clinic director there.
Sweeney.
And they've been with us for several years.
Okay, thank you.
Next is Speaker Jordan.
Well, mine really doesn't pertain to health. I was going to ask if we could to keep our computer use down to a minimum, because the clicking sound is being picked up on the live stream.
Okay.
If that would be possible, if you all have something you need to do on your computers, you might do it in your offices.
Thank you.
Councilor Watts?
Thank you, Madam Chair. I have multiple questions, so you'll just, I guess, have to cut me off at some point and tell me to come back or something.
Well, 3. Everybody, then you can have another turn after everybody else.
Okay. So when are we going to see the cancer data that we had talked about?
Councilor Watts, we're having a hard time hearing you back there. Could you talk just a little louder? What was your question?
So my question to Connie Davis, who's to my left, is when are we going to see the cancer data that we had discussed a few months back now?
I'd like to hear that too, so.
I'll have to go back
hear
and
you.
look. I apologize. I haven't received it. Cancer data, okay?
Then also, we continue to have PACE complaints, and I've asked questions about the structure, asked questions about the audit, have not received a copy of the audit. How is that working? Where are we at?
But I think I mentioned last time that we were on a conference call with CMS or Medicare and Medicaid, when they presented when the PACE staff presented their response to the audit, in which there were several deficiencies or findings, and they being Medicare was very complimentary.
I'm sorry, I'm having a hard time hearing. Can you repeat that, please?
There were several findings, and we, the board members, several were on the conference call when the response to that audit was provided, and they were very satisfied with the corrective action plan.
Okay, so can we still get a copy of that, or?
My understanding is that it has to be requested through a FOIA request.
Okay, I guess I'll have to put it in the little form. I just am frustrated that, we ask questions, we ask here in committee, and we don't get stuff, and it has to be through some other process. It just seems to me like it's slowing down. And this is not just your department, Connie. This is all across the tribe. It's just frustrating. Also, can we get I have more questions, so we'll just have to come back, but my third question, can we also have a daily census for Hastings Hospital, same as requested for Mr. Valier and the Claremore Indian Hospital? I would like the same for Hastings.
Sure.
And then to refresh your memory, that would be a daily patient count, what they're actually in the hospital for, to the same level of detail that George has been asked for Claremore. I'd like the same for Hastings.
Those are, and just in our world, those are referred to as an average daily census report. That's the common thing that we look at on a daily basis, so.
Okay, so I assume we can have that in a week or two via email, maybe, not wait till the next health committee meeting? Okay. Thank you.
You're welcome.
Thank you. Yes.
Connie, would you advise George to do the same thing, send his in email form within the next week and a half?
Okay.
Counselor Buzzard, I think you're next.
Okay. Connie, I couldn't find the numbers on the contract to help patients out of Claremore. Where is it in the book?
Let me take a look here.
I probably missed it.
We started doing since we started the process, it's just part of our overall report now. So if you guys want me to do something different.
If yours are numbered like.
Okay, yeah. Okay, I'll look at it later. The other one, I've got 4 questions. Podiatrists, I just want to put in a good word to look at that for the J Clinic when it expands, because I know the diabetic count in Delaware County is extremely high, and I take it now that we have to travel to Salina to see the podiatrist there, so certainly would appreciate if we could look at the budget for FY16, so there's a need for it there. The other one, I didn't really understand or didn't hear all of it on pain management a while ago. Are we not doing that now?
We're still making an effort to do it, and many of those are handled through our contract health services. Okay. But any pain management that was previously done through Claremore, George communicated to us last Friday during that conference call that a letter was sent out to the patients that they will no longer be doing pain management.
Why is that, George?
In order to follow pain management patients, we just had one provider that was certified in pain management, and we had tons more patients than he could handle. We were inundated with pain management patients, and we don't have the money to send them out under contract health. So the only way we could get control of that was just to cut it off, and then Dr. Smith left.
So what are the patients doing now?
We sent them a letter telling them we were stopping and that they could go by and pick up 30 days worth of pain medicine that they had been getting. And on the flip side of that, there were 4 or 5 pain management people that they were just suggestions because we couldn't refer them out.
But they would be responsible for the cost.
For the cost. That if they wanted to try to go there for pain management, they were welcome to get it.
Is that because of funding from the IHS side?
On the contract health side, yes. On the clinic side, no. to follow a pain management patient, I understand you have to follow them every 30 days, and you can only see so many. We have over 110,000 registered patients.
We don't have many of those at Cherokee that he talked about. We don't have that.
But I will tell you that the guidelines and standards for the required from the physicians prescribing, particularly hydrocodone,
Yeah.
have changed significantly. And this burden will not be unique to Claremore.
Yeah.
This will be something we're already talking about with our medical staff, because the monitoring of the patients is going to be way more strict than we've seen. And we've already been discussing in our medical staff meetings, how are we going to handle this? What do we spend in pain management through contract health? Can you speculate?
It's probably rising to our third or fourth expenditure.
It's a big expenditure, yes.
I knew that was going to be a problem. I knew that. Thank you. That's three. I got one more question.
You have to wait.
Can we wait?
I'll come back to you.
Okay.
We've still got a long list here.
Okay.
Councilor Keener?
Thank you, Madam Chair. I just have three questions, but it's
Just
in
three?
27 parts.
Awesome.
I guess I did have more than three. So I guess the first one is, back in July, there was a sewer leak at the Hastings Hospital, and that's still not remediated. So what's the target?
Those pipelines have been repaired?
Well, it's not put back as it was. Is it going to be just exposed concrete? The files are not back in their place.
The files have been removed from the facility, the records.
Well, right, and I can appreciate that, but it's still just, the carpet's pulled up still, and it's just a hole in that office. So is the carpet going to be put back, or?
Probably not. Those records are actually continuously purged records. So really, we're continuously removing records and removing shelf space as we go along. So we'll probably just leave it as it is. So not leave the hole, but just remodel that department and put it all back in place. But we're waiting on word from the insurance company exactly how they want us to proceed. And we've also been in the process of replacing those lateral sewer lines so that they'll be replace the one on the west. The next part is replacing the lateral sewer line on the east portion of that department.
Okay, thank you. And then I guess number two question is who does the dry cleaning on the towels for the hospital? Is it J Laundry?
It's Superior.
Superior, yes.
Okay. So is there a shortage of towels at the hospital?
Typically, no.
Okay, well, that's what was reported to me by some of the staff, that they couldn't give out towels because there was a shortage. So I don't know if it was just maybe that day on a particular floor, they used a lot of them, and there was a shortage that way or not. But and why is not Jay not doing the laundry for that?
I don't think they could possibly keep up with the business that size.
There's no shared laundry facility.
And there are standards that you have to meet as far as the temperature you wash them and the detergent you use, drying time, temperature.
Okay. Thank you.
You're welcome.
I think that was mine.
That's, that's just a comment, you guys supported the idea of building a new hospital in a 30-year-old facility. Pipes busting like that is a nightmare for the staff, and we hate it for them, and we appreciate the support of the new facility.
Okay, Councilor Fishing Hawk?
What was I going to ask you? Oh, I was looking at your, the emergency department. It's how many patients you see a day. And I divided it out, and it's like a little over 200 patients a day.
Yes.
Oh, my word. Are we putting any extra doctors or anything in their contract?
In the month of August, we trended it out, and we noted that on Mondays of all days, they're particularly busy. And so this last month, they did do a double coverage on Mondays, or at another 12-hour shift, and they're analyzing that data. To be honest, I think the initial reports aren't as good as we wanted, but we're going to keep watching and monitoring.
Thank you. Oh, that's all I can ask you. Thank you. And there's something else I was looking at. I'll go back to it maybe if she'll let me.
Okay, Speaker Jordan, you're next.
I saw in your report where you had 398 surgical procedures.
Yes.
How many doctors are we using to cover those?
I believe we have 6 full-time surgeons and an orthopedic, 1.5 orthopedic surgeons.
And my second question is, I could not find how many babies we delivered last month.
I don't believe we report that, but we can.
Okay, if you would start putting that in the report. And my third question, would you just go back a year and do that census deal for the hospital? Instead of just the month of September, just go back a whole year if you don't care. We'll give you an extra week to do that before you have to send it to us. And George, I didn't realize you were still back there, or I wouldn't have asked Connie to talk to you about that. But if you'd go back a year and just let us know what your census count was.
Okay.
Thank you.
Okay, anybody else?
Oh, I remember my question.
Oh, you remembered your question, okay.
Did you have in here talking about pain management, Dr. Montgomery?
Yes.
Okay, good. I'm just making sure I'm telling my patients and people that call me the right thing. I've had 2 or 3 call me, well, 2 or 3, a lot more than that, that's called me about the pain management, the back, the palladium and everything, and this is what I tell them, and I'm just wanting to make sure I'm telling them right. We got palladium because we had chronic pain management, different problems, especially with the back, evidently, because all of them has to do with the back. Palladium sees their case and sees basically if we're doing any good for them or if we're just giving them pills. I mean, in a nutshell, is that not what we're kind of doing?
Well, I think what they do is make a recommendation for the best course, the most conservative treatment for their pain.
It's almost like a second, what's the word for it? Yeah, that's what they're doing.
To most primary care, and Dr. Montgomery, please, I don't want to speak for a physician, but generally if they have a back problem, they want to refer them for an MRI. Well, that's a huge burden, as Claremore knows, and we well know, on the health system, and it's expensive and may not even be necessary. So they consider alternative treatment plans such as physical therapy, chiropractic services, those kinds of things.
Now, see, that's how I took it. Palladium's there to say, okay, is this patient doing any good, or is he just seeing a doctor, and the doctor's just got 2 minutes with him, so he just writes out his prescriptions and tells him to go on.
That is part of it.
And now we got somebody that's actually looking at the health record.
Yes.
Deciding if there's a better way to handle it, or if maybe it's even the wrong thing. Maybe they need to look at something else in it.
Right.
That's what Palladium's doing.
Yes.
Okay, that's what I've been telling them. I've been getting gripes. I try to tell people it's kind of good for you and us.
The major complaint is patients who have been on the steroid injections in the back, and if they don't document that it's been effective, then they deny it. And it's up to that provider that's been delivering that care to do that. And so we've pretty much narrowed it down to one provider group as being most resistant to this. And we've had several meetings with them to encourage it, or we'll just quit using them because it's not fair to the patients. They get caught in the middle.
Okay, that's what I was trying to figure out with Palladium. Okay, thank you.
You're welcome.
Councilor Vasquez.
Thank you, Chairman. Connie, this is in regard to flu vaccines. And first, I wanted to compliment Elton Sunday at Bonita for him calling me and going over the fact that I could either offer, I couldn't have the flu vaccines right now at my next community meeting, but if that he would work with me to set up special meetings at like Welch, at wherever we can find a spot to do that. So I'm working with some people on that. But would you explain to me again the vaccine itself? Did you say, or did I hear that there are 2 different types, or we're waiting to get the one flu vaccine that everyone can take for this coming year?
That's exactly right. We're waiting to get the one.
The one, okay. And that will be in October, correct?
First week of October is what Jeff is predicting.
Okay.
I think most flu clinics are going to probably be, we feel comfortable saying after October 6th.
Okay.
We should have our vaccines licensed.
Great. Okay, thank you.
Really, what happened is one of the lots from the major company had failed an FDA inspection, one of the criteria. So that backs the whole process up about 30 days. Normally, yes, we would already have our vaccines.
Okay, thank you. Thank you.
Councilor Hargis?
Connie, I just wanted to ask you, if on the daily census that you're going to send us, would y'all break down also how many are Cherokee?
Okay.
Also from Claremore. George is still here. Is he back there?
I don't think he heard you.
George, on the breakdown on the daily census, would you include how many are Cherokee?
Sure. Now, you realize I don't have access to which are Cherokee citizens and which are Cherokee card holders.
I understand that.
Okay.
Thank you.
That's it.
That's all.
Okay.
Any repeats? Second chance.
Councilor Watcher, first on the repeat questions.
May I just get them over with, or do we still limit it to 3 and you got to come back to me?
Well,
Yeah, let's go 3.
let's just have 3 questions and come back again if you've still got more.
On your data, every month we look and can see like what the major driving long-term illnesses are probably for most of our patients, particularly hypertension and diabetes. So I haven't heard maybe as much about prevention and lifestyle choices and training and those kind of things. So where are we at? Because for the most part, the way I understand those diseases, some of them can be genetically driven, with little control by the patient. But the way I understand them without being a medical provider is really it is about choices at the end of the day.
Well, you're talking to an insulin-dependent diabetic of 40-plus years, and a lot of it in our...
And I'm assuming type 2, I don't know, not to get personal, but...
Yes.
Okay.
In type 2, many times it is personal choices. The choice of what we eat, smoking, those are the big things, the amount of exercise you get. But there is a report included in that. I haven't highlighted it. I get accused of favoring diabetics because of my personal connection many times, but we have a very aggressive diabetes program that serves a lot of patients and providing strips, education, teaching, and there are many success stories that we could share.
And I guess I know that once someone's diabetic, I mean, it's hard to reverse that if you can ever say it's been reversed. But I'm talking about sheer prevention, starting with our young folks and more community-wide such. I know we have the WINGS program, and I'm on that. I get the emails whether I show up for a run or not. But we haven't expanded. We don't seem to be focusing on it. That's what I'm concerned about because every month I've sat and looked at that data, and it's...
I'll do a better job of highlighting our efforts because I tell you what, we have a very aggressive staff, and something that I didn't get to report last month that I had wanted to share. We went to a leadership training in Chicago. Dr. Montgomery, Brian Hill, and some members of the administrative staff, and they were bragging. A big healthcare system was bragging how they had kept their hemoglobin A1Cs under 9 at 40%. That was their goal. And that's an indication of how well your blood sugar has been controlled. But our system, our challenge, our goal is under 8, an A1C of under 8, and over 60% of our patients are maintained at that. So that shows the great efforts of our docs, first of all, but of all the prevention classes, the dietary support, all those things. So I'll be glad to share that. And
I appreciate that. Thank you. And then just a comment is congratulations on all the IHS awards across each of our clinics, our facilities. And it was pretty diverse. It was impressive.
It was very.
In another comment on your personnel report, there were several that were missing ethnicity still. And that we brought that up before.
Yes.
One question, the second question, Marcoma funding reviewed. I know at one point that had been cut out, and then there was the discussion. This is over the last year or two. Where are we at on funding Marcoma and how that ended up? I don't recall. Maybe I'm just not remembering it, recalling it. But where are we at on the funding of Marcoma and how that's being, the usage and such, because wasn't that an issue at one point where the money was cut? At one point, it was probably restored, but
That was in last year's, the previous year's budget, if I recall, and you and I are, if I'm talking about the same thing.
would you give me a call at some point?
Yes,
Thank
I'll be
you.
glad to.
So my third question is on, and I think Mr. Councilman Buzzard brought this up. So we've changed reports on contract health service, and I understand we're combined now, but it was very useful to have that additional information because we still have a whole group of folks that seemingly still have to go through Claremore. And I know that you and Brett particularly work through these case-by-case issues with me, and I really appreciate it. But I like having the data to understand, is this just because I'm in Rogers County that I'm getting this greater number of issues, and I can't talk to them now about how well we're doing and the number of volume that they're compared to, because it looks like it's combined. Because, so in the report, which would be page for us, you know, obviously on page 6, which is page 2 of the Claremore Hospital, just to clarify mine again, George, Mr. Valier did state that is simply those that do not go through Cherokee Nation that are reflected in that report. And then on page 18 and 19 of our report, which is your last and second to last page, I believe, in your report, it starts with contract health services, but instead of having the breakout that we did prior to this by town and some of the additional information, it was very helpful. We're still in a mixed service area in terms of inpatient, outpatient. And at least for a while, I would like to continue seeing the separate numbers because I can't really tell, you know, from a statistical perspective, from an overall perspective, how we're doing. And if people are just having one-off issues, I'd like to be able to say, you know, we've successfully processed 300, that's what the report said last month. So it gives them a different perspective, and it's not just about their case.
So to clarify, I see what I think you're missing is the breakdown by county that we usually include.
So we had it based on their address. I think it was the patient's address. There were so many from Vanitas, so many from Claremore, so many from Owasso, whatever it was. It was extremely helpful to me.
Okay.
And I don't know what, I mean, I want Brett working on delivering services, but at the same time, I can't tell what that looks like as we've transitioned without that additional reporting.
Good.
I have 3 more after when you're ready, so.
Who's next? Councilman Buzzard.
Councilor Buzzard is next.
Okay, I have a question about dentist. In J, Dr. Jones, I understand we have one dentist and we used to have a dentist 3 at 4. What's happening and how many chairs we have, and I'd like to know what those dental assistants are doing now with only one dentist there.
We have another dentist coming on, he's going through credentialing right now.
I see that's in December.
Yep.
Yeah,
And they
that's 3 months
the
away.
credentialing process and get the Oklahoma license and that, all the stuff that they have to do. You had 4 dentists there at one time, you only had 8 chairs and 1 hygienist, so you had people sitting around doing not very much work. So we spread them out a little bit, and then we had a dentist that completed their scholarship fulfillment and had left. So we've been trying to fill that position. That's not easy to fill. But we've got a gentleman that's going to be taking that, and hopefully we'll get him on before December. December's our realistic date. We're optimistic we'll get him on a lot sooner than that. Just depends on how credentialing and all that goes. We only meet once a month, and how fast he gets his Oklahoma credentials.
Yeah. The other one is on, and I don't know if the other council members would like it, but I would like to see a report on how many dentures you're issuing or giving the okay from.
It's in
same height.
It's in your report.
It is.
Yeah.
Okay, I've missed that again.
And something that may help is the number of chairs per dentist Dr. Jones, that would make the clinic most efficient? Because you think 12 chairs, well, we need 12 dentists, and that's not the case. So,
Usually what we allow 2 chairs per hygienist and 2 chairs per dentist, and then we always keep a couple overflow for emergency walk-ins. So typically you're going to have, for an 8-chair clinic, you're going to have 2 dentists and 2 hygienists. This takes up all your chairs, and you have none for overflow. So as you have overlapping schedules, you're going to have some days where you're not going to be completely fully staffed and have overflow chairs.
That's good information. I didn't know that, but that's good information.
and to answer your other question, it looks like 76 patients were referred for dentures or partials.
Is that broken down by clinic? I saw.
No. This is
I'd like to see that broken down with clinic, Dr. Jones, if you would. Okay. Thank you, Madam Chair.
Okay.
You might just want to make a packet to hand out to everybody for each clinic.
Councilor Byrd?
Everybody's gone round 2. I think I'll go round 1. Marcoma, something to think about as we expand our health facilities, and we're going to start implementing these workout facilities there. There, we're close to, last time I looked, we're 9,500, maybe closer to 10,000 members.
Yes.
We do charge for non-tribal members there.
Right.
If we start getting overcrowded, that's something that we need to do an assessment and get with the managers and see how that's working out. Because I don't want our Cherokee people not to have a place to work out. But we're not there yet, but we really haven't done an assessment of that. So you might get with your managers to do that.
Sure will.
I was just talking to the Madam Chair here. If you do something like that at some of these health facilities, you need to start looking at, are we going to charge? Because if you've got a tribal member married to a non-tribal member, are you going to give them a family deal or what? See what I'm saying?
Sure.
Just something to think about in our planning. But Marcoma's doing well. Like I say, 9,500 to 10,000 members.
It's busy any time of the day, I know that.
Absolutely. Thank you, Madam Chair. Thank you for all the support from Marcoma. It's doing very well.
Councilor Walkenstein?
I concur with Chief Byrd. I think as we look at expanding these workout facilities or whatnot, or if we are, there's areas like, Adair County. Those people can't drive all the way to Marcoma to work out. Delaware and Mays, and it'd be really neat if we could get an old gym that's a school gym or something closed down or something, or if some council members use some of their funds, I guess, to maybe get something like that going. But it's a huge need in these communities, though. It really is. I don't know. That's my opinion. But anyway, thank you. Thank you, Chair.
Councilor Keener?
Thank you, Madam Chair. What's the estimated time of completion, you think, from the insurance on the records room?
I don't know that we did receive some of the records back last week, and I haven't been updated on a time frame for completion. Have you?
No.
Okay. And then there's been a consultant hired in behavioral health. I can't remember when exactly that firm was started.
Oh, well over a year ago. It's Arthur Holbert, who's been helping us with the productivity and primary care, the OR, throughout the entire health system.
So now that there's not a wait list there, will that contract be ending?
He has a list of assignments that we're working on to make sure we're efficient in all departments. But yeah, we've about weeded through every department now.
And has he hired his own employees as well? Has he brought in other employees? Or
He has a staffing company for physical therapists, and that was in place before when I took this job, as a matter of fact. And so, yes, that's a separate contract.
Okay, I think I asked 3. Thank you.
Okay. Councilor Fisher-Knox?
What's the deal with the records?
Whenever the sewage line broke, it spilled contents onto several medical records. And so we have sent them off to be cleaned.
Thank you.
I have something. In your report, you said we were seeing 200 people a day at the emergency room?
Yes, ma'am.
Okay. This is my directive to you and Dr. Montgomery. Try to get these outlying clinics open for urgent care, extended hours to at least 9 o'clock at night. And that would cut down on a lot of emergency room calls and everybody going to the same, central location, and be a lot quicker. And I just think we need extended hours, especially for people that work until 5. And I'd like to see a plan. I know we don't really have enough positions to cover during the day right now, but we need this in our thoughts coming up, because this would really cut down on everybody driving to Hastings.
We agree, and we have looked at that, and we'll continue to look at that. It
Do
take
we
a
have
lot of money.
extended hours anywhere right now?
Nowata and Muskogee.
Well, someone had
And
told me
yes, Stillwell started
they were doing till 6 o'clock at Redbird, but is that true?
No, not yet.
Okay, that's, okay.
They are in the dental clinic, we're open till 6 in the day.
Okay, we don't want to leave you out. All right.
I think in primary care was the question, yes.
Our time is up, and I think all you counselors that still have more questions just need to stop and visit with our health director or Dr. Montgomery personally, because we've had several opportunities here, and we're getting further and further behind, and we need to go on to our old business.
I appreciate your respect for the time of the other chairman.
Thank you.
Point of order, this is 65% of our budget for the tribe, and I had no prior knowledge that we would be limited on the number of questions until we got here today.
My answer to that is unless we want to change the way we're doing this, because we're scheduled an hour. If we want to come in earlier and schedule health for 2 hours, all these other people get quite angry at me for letting the meeting run over, and they've got their guests and different ones coming in, and they're having to wait, and they're getting disgruntled and leaving, and they're leaving their jobs to come over here to give their reports, and they want to give them, and a lot of times they'll just like, well, we'll just take the written report, and they've sat there for 2 hours, and I want to keep these meetings running on time, a little bit closer to time.
Thank you.
And I want to start on time, and I want to, so we've had our hour. So that's going to be the way I run my meeting from now on. 3 questions each, and we'll make the rounds and come back and do 3 more, and that's fair to everyone. Yes.
Might remind all of the counselors, you have Connie Davis's number, you have George's number. I know that they would take calls from you at any point in time. In fact, I probably talk to Connie every other day during the month. So I get most of my questions answered before I get here to the meeting. And I'm seeing some folks nod heads, so I know a lot of people are using those phone numbers so that we can get our questions answered before we get here. And I've never had them not answer a question for me if I call them. So I appreciate you all taking the time, offering your phone numbers, and I feel comfortable talking to other staff there at Hastings. I have all their phone numbers. I know you all have all their phone numbers. You can get a lot of your questions answered by simply emailing or calling them. Thank you.
Okay, old business, we have none. New business, none. And next is announcements. Anybody have any announcements? Councilor Thornton, we have one. Councilor Thornton and I are having a community meeting September 30th at Blue Ribbon Downs at 6 p.m. Anyone else have an announcement? If not, I'll entertain a motion to adjourn. Second. All in favor of adjourning, let me know by saying aye. Aye. Any opposed? Meeting is adjourned. Thank you.
Yeah.